Welcome, dear friends, colleagues, and medical students on MuniMeterHealth, your favorite site where we talk about cardiology and human heart. This is Dr. Jaitly from New York. I'm going to be talking briefly in this particular section, what is early repolarization. Now, very importantly, early repolarization is an ECG criteria where you could see an early elevation commonly seen soon after the QRS is just about to end, and that's where the T wave. So there is an early J point elevation. We call it a J point elevation, and the minimum elevation should be at least more than 0.1 millivolt. That means one small little box here in the EKG. Okay, so that's one criteria. The second criteria for a P wave, which could be a little variant from the J point elevation alone, is you have a P and a little QRS that's ending here. As the QRS ends, there is a little notch and then a T wave starts. So here comes the notch. So you have a J point with a notch, and the third variety obviously is here. We are looking at, which looks more like a slurred pattern. So you have a little slur here, and that's the slurred pattern of the J point. So one is a clear-cut J point elevation of 0.1 millivolt. The other one reflects a notch and then a T wave, then the T wave, which is obviously over the baseline, and a slur here, which is commonly seen in the descending limb of the S wave, if you will. Okay, so now very importantly, this mimics. Why is it important? It's important because there are certain clinical conditions which it can mimic. One, obviously, these patients are presenting into the emergency rooms or in the clinics where routine EKG is being done. So patients may present actually asymptomatically, but many times they may have symptoms. So the early repolarization patterns, which we've just seen on these EKGs, will mimic something like a myocardial infarction, a ventricular aneurysms, or even pericarditis. And now remember, each of these conditions are very, very and highly symptomatic. And then, of course, they have a morbidity and a mortality attached. So these are very, very clinical significant conditions. And do not forget hypothermia or hyperkalemia. So high K and, of course, low temperatures. Profoundly, these patients have been out in the cold weather for a long time and they present. So there is some history of hypothermia in these patients. If you were to do a blood test, the potassium may be high beyond 5.6. Normal is anywhere between 3.4 to say 4.5, and anything above is 5.3 is beyond, is 5.6 is potassium, which is elevated. Pericarditis, where you have classic presentations of pericardial rub and chest pain, which is related to positional variations, and then, of course, an acute onset, sometimes accompanied by fever and elevated ESR, and, of course, the EKG will reflect a similar pattern of early repolarization, but that is, and then there's an upward concavity to these ST elevations. Remember that. Ventricular aneurysms, of course, could be ascertained by an echo, and there will be previous histories. Remember, very importantly, any EKG which you are interpreting, make sure that you also have a previous EKG available if it's done. If it's not done, obviously you can't help, but if that's been done, it should be retrieved from the medical records from other hospitals, other centers where they can fax it over, scan it over, and send it over to you, or sometimes the patients just bring it over in their own files. Myocardial infarction, obviously you have to look at from the enzymes and evolving EKGs while the patient is being watched in the subsequent hours or subsequent minutes. A repeat EKG will certainly help. So all of these conditions could be really identified, and if early repolarization was mimicking it, then you can actually make the correct interpretation of it. Now, there are high-risk situations where you have to be very, very careful. A J point where normally, remember, if it's benign, in all benign conditions, normally it will be in the lateral. This J point elevation will be seen in the lateral leads only. But and in contiguous, remember, it has to be seen in contiguous in 2 or more leads. So V4 to V6, if it's present, it's normally considered as benign. That means 95 to 99% of these patients have nothing but just a normal variance, and this is called early repolarization. But places where it could be very, very significant, and those are the ones where you have either global, where all leads in the EKG will show this early J point elevation, and specifically so in leads 2, 3, and AVF. Now that is considered, it has a very negative connotation. Remember that. That means these patients are very, very significantly sick sometimes, and obviously these conditions will have to be excluded. A third caveat to this high risk situation is where if you see an ST segment which is following this J point is either horizontal or it is actually depressed. So ST segment depression or horizontal ST segment, that'll signify an abnormality as well. So these are some of the caveats you have to be very, very careful with. And of course, if it is more than 0.2 millivolts, that is considered as very significant abnormality also. So, there's a criteria that there is a 0.1 millivolt elevation. But if it's more than 0.2, that should be considered as abnormal. Remember, also there is a history. Now, there are certain situations where patients are presented with sudden cardiac death episodes, or they have had a primary VF in the past, or they have been treated for syncope, and repeatedly these patients are showing up so those are clinical criteria where you have to really assess these patients in the context and then make an interpretation of this EKG. It's not like just looking at an EKG and making an interpretation of. You have to look at what the company it keeps it, and that's why EKGs must be accompanied by some history, some physical examination findings, an echo finding, etc., and then you can make a good EKG interpretation of it. And that's what these short videos are for. So here we are preparing medical students, residents, and fellows who are taking the exams. I call them exam-going colleagues. And of course, our goal is to really present in small Cardio 360 videos here on MuniMeterHealth to improve the patient education and medical education so that we can improve the clinical outcomes as a whole. Once again, this is purely an educational channel. We are not offering any medical advice, and should you be having an emergency, please dial 911 and get to the nearest hospital. Go and see a doctor right away. Okay, thanks again for watching MuniMeterHealth. I appreciate and looking forward to meeting you again on the next one. Bye now.